too much protein in the diet. Protein, particularly animal protein, is very acid. It causes acid in your body. In order for the body to neutralize that acid, it has to take calcium out of your bones. So really, the more milk you drink, the more osteoporotic you become. Milk has been shown to be a major factor in the onset of diabetes type 1. That's called juvenile onset diabetes. It seems that in the milk protein, the protein we call whey, that's W-H-E-Y. Remember little Miss Muffet sat on her tuffet eating her curds and whey? Well, it's that whey that has a protein in it which is very much like a protein that's in your cells in your pancreas called the islets of Langerhans cells that form the insulin. So when you take this protein in milk into your body will produce antibodies against that foreign protein. But since the protein in your pancreas cells is much like that other protein, your body will then start destroying those cells, so then you can't produce insulin. And that seems to be one of the major causes, and this is well documented in the medical literature, one of the major causes of juvenile onset diabetes, the diabetes that is so serious that requires insulin all the rest of your life. Milk has shown to be a factor in an increase in breast cancer, certainly is a factor in heart disease because it contains really mainly fat and protein. There is an increased incidence of leukemia in milk drinkers, and that's probably because something like 80% of the dairy herds in America are infected with the bovine leukemia virus. Did you know that? So when you drink the milk, the leukemia from the cow may be transmitted to the human. Now you say, well, the milk is pasteurized, and when it's heated to a high level, maybe it will kill that. Well, first of all, you have to realize that a lot of milk gets put together. Some of it's pasteurized. This is an error, but you know human error. So you can get unpasteurized milk in with the pasteurized milk. There is a connection of milk with multiple sclerosis, with Lou Gehrig's disease, which is amyotrophic lateral sclerosis, with the Crohn's disease of the colon. This is a colitis type disease. And of course it causes mad cow disease, which is in human beings it's called Creutzfeldt-Jakob disease, and it's virtually the same thing as Alzheimer's, only it occurs in very young people. Milk is associated with ulcerative colitis and female infertility, as well as learning difficulties. So here you've got milk, coffee, caffeine, or any caffeinated beverage. You know, you've got sodas, and they all have caffeine in them these days. People drink them to help give them a lift. And then you have white bread, where they take all the nutrition out of the wheat bread, and then they put in a few vitamins and minerals, and then they call it enriched. Well, this does not build healthy cells. They do the same thing with rice. Take organic brown rice. They can take all of the outer coating off of the rice, and now you have white rice instead. There's something else that we discussed. The MSG and the aspartame are called excitotoxins. In fact, there is a book out called Excitotoxins written by a neurosurgeon, Dr. Russell Blaylock. You can actually get it at your bookstore. These excitotoxins cause headaches, they cause grand mal seizures, they cause brain tumors, Alzheimer's, they contribute to Lou Gehrig's disease, amyotrophic lateral sclerosis, Parkinson's disease, Huntington's disease, and they actually have an effect on the endocrine system. So if you have hypothyroidism or hyperthyroidism, you have to actually consider whether these things are part of that problem. Also, these excitotoxins, MSG and aspartame, which is the NutraSweet brand, cause difficulties in embryological neurological development. So if you are pregnant, you better start thinking about eating natural. Well, if it's not bad enough that we have all of these problems with our food, we take medications. And medications, of course, all have side effects. The antihypertensive drugs such as reserpine and aldomet and catapres, they will cause, and Inderal will cause depression and delirium. Anticonvulsants like Dilantin and Tegretol and Klonopin cause depression, disorientation, delirium, and hallucinations, plus many other problems as well. Anti-inflammatory drugs like Indocin and Naproxen can cause depression, confusion, paranoia, delirium, hallucinations, and many of these have liver toxic effects. Some of them are toxic to the kidneys. And the steroids, of course, like prednisone, they cause depression, anxiety, osteoporosis, and many other symptoms as well. Even antibiotics have lots of side effects. And antibiotics even don't really cure disease because, you see, when we use antibiotics, antibiotics only kill. They will kill some bacteria. They don't even do that very well anymore. They do that if we're lucky. But you see, if you take antibiotics, they will be wiping out the good bacteria in your colon. And so then you are susceptible to things like candida or chronic fatigue syndrome, fibromyalgia, things like that, because you need those good bacteria in your colon to help digest and assimilate your food. So when we take medications, they all have side effects. They all are harmful in some way. So when you take a drug, you may relieve the symptoms of the disease that you're attacking. But drugs never cure disease. They only change the form or location of the disease. In fact, even with antibiotics, every doctor and nurse has seen patients die who have been given doses of the appropriate antibiotic. When you get well, it is not the antibiotics or any other drug that gets you well. There's only one system in your body that can get you well and keep you well from every disease, and that is your immune system. When you take drugs into your body, every single drug has an adverse effect on your immune system. What we really need to do is learn how to get out of the way, eat right, and get rid of the medications in our life so our body can learn to heal itself. Now, if you're on medications, I want to give you a warning right now. After you hear this presentation, you may say, I want to get off of these. You can't get off of your medications rapidly. Don't stop them abruptly. When you get off your medication, you want to do it slowly and under the care of a knowledgeable healthcare practitioner. But indeed, you do want to get off of your drugs. And after you hear what we have to discuss today, you will see that you can be well without drugs. There are a number of other things that we do every day without even thinking about it. Things that are so routine they never even cross our mind. If we drink water out of the tap, it contains chlorine. Chlorine is a poisonous gas. The government tells us we have to have chlorine in the water for our safety. However, many cities around the world are actually purifying the water with ozone treatment, which is a harmless substance. It's a form of oxygen. And yet they add chlorine to it after the oxygen has done its work. Fluoride is also in the water. The government is mass medicating the public. We're told that it's necessary for preventing tooth decay. But there's a big controversy about whether fluoride actually does prevent tooth decay. And in fact, fluoride is a poison. It is a byproduct of aluminum production, and it's used in rat poison. It also causes brittle bones. It causes premature aging of the skin. And again, it is very controversial as to whether it really prevents tooth decay. Not only that, Congress has recently made a law that they have to have a warning on toothpaste that contains fluoride, because some young children have actually died because they've swallowed the toothpaste after brushing their teeth, and some have died or gotten very sick in dental offices after they swallowed the fluoride that was put in their mouth in the